Welcome to the Pink Pill RX podcast, hosted by Katie and Jay Fillmore, where we navigate complex and thought-provoking topics surrounding women with a focus on education. For shorter form content, follow us on TikTok, Instagram, or YouTube at Caters88 or Pink Pill RX.
That's KATORS 88.
If you enjoy this podcast, please give us a follow and maybe a nice review.
Before we begin, I do want to remind our listeners that with the potential TikTok ban on the horizon, which it's not looking good, folks, you can always find us on YouTube and Instagram, and we are committed to keeping our community connected. So we're going to continue to post on those platforms. Make sure to follow us there. You can find us under Pink Pill RX. You can also find us under Caters 88, and you can enjoy our content from there. And hey, if you love what we do and you want to support our mission, consider joining our Patreon for $1 a month. We're not hiding content behind a paywall. We're just asking for support. With TikTok being banned, that was providing a lot of monetary support to continue this mission and to continue the flow of content. And unfortunately, we're not going to be able to earn on TikTok anymore. So your contribution would help us continue bringing you this content. So for today's episode, to start us out with a little appetizer, because last week's episode was super heavy, this is a question we get often. How has discussing this stuff over the last, 8-9 months changed you, Jay? It changed the way that you've interacted socially, changed the way that you think, or just any kind of changes?
Yeah, I'm going to think about that in real time because that's my trademark, thinking about something in real time and having a real time reaction to it. So I will say I feel a lot more comfortable and a lot more emboldened to talk about these issues with other guys. Like, for example, you and I had lunch with two of your brothers talking about goals and stuff for 2025. And you were talking about the podcast. And they said, "Oh, what's it about?" And I said, "Well, it's talking about issues that pertain to women." And your brothers, or at least one of them, was kind of like, "Oh, okay." And then you had said something. And then I said, "No, you don't understand. Did you know that women will check under their car when they walk up to it, because you don't know if somebody's under there who's like there to like grab you and do something harmful." Because like guys never think to look under their car. He was like, "Well, I look in the back seat, when I get in the car," which good for him. But I'm just like, when the topic comes up, I'm like, "No, you don't understand. Let me tell you what I have learned, what women have told me. Like, this is nuts." So I feel a lot more comfortable just talking about it with other guys because I'm like, dude, like, this stuff is crazy that you and I never think of. It's wild.
How is that received?
Sometimes there's some pushback, like where they want to like, how people can ask a clarifying question, but really it's like under the guise of trying to discredit your original point.
Yes.
You probably know better than I do. So let's say as for an example, let's stick with the looking under the car thing. And he'd be like, "Oh, well, but like statistically, how often does that happen?" And they'll try to say like, "Oh, that's just an overreaction," or something like that. That type of response where it's not like overtly confrontational, but it's subtly trying to cast doubt on the point that I'm making, like that type thing. And then also some other guys just like listen and don't really have any comments or things to say about it. Like there's not opposition, but there's not really curiosity either,
Yeah, is that like the two reactions you get? I think that's probably pretty much the two reactions you get is opposition and silence.
Yeah, subtle opposition and silence, which, it just doesn't seem like any of the guys I've talked to are particularly curious. It's strange to me.
Does it bother you at all?
Yeah, it does. On several different levels.
Tell me about the levels.
Because I'm like an onion. There's lots of layers here. One is that I think on some level I'm like, you don't care? Like if you're not curious, you don't care? Why would you not care? But it's like I'm dumbfounded at why you wouldn't care. And maybe some guys that are silent, maybe they are kind of contemplating taking it to heart, sure, but like there's no outward expression of curiosity, which is like, dude, you don't care. And then also I'm like, are you just curious about the world at all either? Are you just like an uncurious individual? Because like I don't understand when people have a lack of curiosity about things they're confronted with, that doesn't make sense to me. And it's like there's some level of disengagement from the world around you if you're not curious.
But put some football players in front of them, and all of a sudden they know all the facts and all the figures and all the people.
Yeah, which is interesting because I've never really been super into sports, like watching sports. Yeah, and you can know all types of that stuff, but then there's not curiosity for things that are more on the human side. I don't know. It's when I'm confronted with that, and it's not like every person I've talked to. I can think of one friend that I haven't seen in a long time. He would be like, "Dude, that's crazy," and he would like actually engage with it probably.
I think it'd be fun to do a little experiment and talk to them about like guy statistics. Like, did you know that da 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 da? Like, but about guys, right?
Uh-huh.
And see if they have curiosity suddenly or not, because then that would show that like, oh, well, there's this almost like this probably dehumanization that's going on. If there's, do you know what I'm saying? If there's like this curiosity, but yet this complete ignoring or this contradicting of women's experiences. But if you like bring up guys' experiences, if they'd be like on board, even if they didn't have never experienced that before.
Yeah, I could see that happening. I also wonder if it would be, oh, this actually pertains to me. So like, is it a dehumanization or is it just more like egocentric?
Well, all those men are married.
Oh my. Okay.
And some of them have daughters.
Yeah, and then I'm like, well, okay, well, are you not friends with your wife? Are you just married to her? Because if you're friends versus like, I don't know, if you're friends with your wife, you're gonna be freaking curious. That's your friend. That's your best friend. You know what I mean?
Yeah. I had a follower question. What would our advice be? This follower experienced sexual assault, told a very close male friend who she felt was an ally and who had acted like an ally and responded like an ally, but then continues to hang out with men that she knows have done such atrocities or dabbled in such atrocities. Mm-hmm. And then what do you do about that when your person is intermingling and not finding an issue being with other people who have done that?
I think I have an initial question, which is this male friend aware of these other guys dabbling in stuff like that?
Let's say that they are.
Okay. Then I mean, you're close enough with this friend to share this experience you had. I think you go in with like, hey, like almost like you are the curious party. You know, hey, I really appreciate your support and letting me open up to you. You're very supportive. Your response was very helpful. But what I can't get out of my mind is you spend time with so-and-so and so-and-so. You know, did you know about X, Y, and Z? And if he says yes, then she'd, okay, well, I'm curious as to, you're so supportive. And an ally, I would call you, for myself and for women. So why, like, are you okay with it? Or like, why do you find their company enjoyable when at their core, it seems like their core is like diametrically opposed to you and what you believe and what you value?
So approaching it with curiosity.
Yeah, because telling him what, like, to stop associating, that I don't know this dude, and I don't know if he's like really close friends with these other guys, and so like if it's going to be like a dig in your heels type thing, if he's confronted with it as like a, you need to stop hanging out with them. But if you come at it with like, with a curious disposition and kind of put him in the hot seat to explain and see what comes out.
Yeah, I think that's great advice in general. So like when you're sharing something with a guy and you can tell that they're discrediting you or they don't believe you, and we'll just say a lot of times this can be spouses or this can be close male friends, flipping the script and being like, that's curious. Why do you automatically discount that? Or, that's curious. Where do you get your information from? That would be more accurate than my information. I'm just curious.
Yeah. And even saying, I shared some data with you and you're obviously not agreeing with it. What data do you have? What information are you working with then?
Yes, if you have the patience.
I got into a disagreement with a friend of mine, and it was like there's like 6 of us playing board games. I got in disagreement with one of them. It was a political thing. And he kept citing like his own personal experiences with people. And I just kept saying, dude, this is experience and anecdotal at best. Where are your statistics to prove your point? And I kept saying it, and a couple of the guys found it so funny that I just kept like, dude, where's your information? And he didn't have any.
Receipts.
Otherwise, you're just going off of what? Your limited experience? Okay, I was a math major. There's something in statistics called sample size. And most people know this in the scientific community too. The smaller your sample size for when you're conducting statistical research, the less accurate your results are. The larger the sample size, the more accurate your results are going to be. So if you're going only from your life experiences and interactions with people, that's a very small sample size compared to studies that are done with thousands of people.
That's why I love meta-analysis studies, where they look at all these studies.
There's like people do studies that are actually studies of large groups of studies.
Yeah. It's called meta-analysis.
I didn't know that. I'm not in the, reading medical journals and stuff like that, which you're much more well-versed in than I am.
Well, I'm happy that you are having those conversations. And I know that I speak also for a larger group of women who are very happy that you're having those conversations.
Yeah, it's when I've heard so many things from you and reading the comments and the limited messages that you share with me, because a lot of messages that are shared with you, you keep private, which I think is great because a lot of things probably are meant to be private. But I'm at the point where I'm like, dude, this is I got to tell you this. Like, this is unbelievable. Like, I am so convinced. So I got to talk about it. I'm just so confident what I'm talking about because I believe it 100%.
So there's a story that broke about Brooke Shields. Have you seen this come across your feeds at all?
I don't know. Could you start in it and then maybe it'll sound familiar?
Yeah. So she was talking about a surgery that she had. Have you ever heard of vaginal rejuvenation surgery?
I think I've heard that phrase a couple times.
Okay, so basically they do muscle tightening stuff. So they like bring the muscles together to make it tighter, and they usually remove tissue. They suture it to make it tighter. Post-operatively, they have to have like stenting up there, like a stenting device, so it doesn't completely like heal up and make it impossible for anything to be in there. And so they have to have a stent in there for like 5 to 7 days. And patients are usually down for like a week or two because it's very painful. Of course, you can't use any tampons. You can't have intercourse for 8 weeks following the surgery. And then a lot of times for follow-up and recovery, patients are instructed to do vaginal dilation once the packing's removed with specific schedules. So that's like stuff that you stick up there to like dilate yourself. So that's a surgery she got. And usually the recovery and resumption of all activities, it takes like 6 to 12 weeks to recover from something like this. So that's the surgery she got, but that's not the surgery she went in for. That was a bonus without her consent.
Oh my gosh.
She went in for something called a labiaplasty. And this wasn't, from my understanding, this wasn't for cosmetic reasons, which no dig against anyone who does it for cosmetic reasons. But it sounds like it was causing her pain since she was really young, like high school. So she had some issues with her labia, and it was because sometimes they can be bigger and sometimes they can rub and they can cause chafing and all kinds of different stuff. So she was going in to get that fixed. And when she came out, the surgeon said, hey, guess what? I gave you a bonus.
Oh my gosh, that's your body.
And she wanted to sue him.
Yeah.
But she decided not to sue him because she didn't want her private parts on the front page, like talking about everybody talking about her private parts.
Oh, what a hard place. Oh my gosh.
Isn't that just wild?
Yes.
These unconsented to medical procedures that are done on women. And women of stature. Not even, this is not some obscure random person.
Yeah.
Not that that person would be less valuable, but what I'm saying is like, this doctor was so emboldened that he did this to a celebrity.
Right, who has a louder voice and is more connected.
That's how emboldened he was.
Oh my gosh. The horror when she came out of surgery.
Yeah.
The absolute horror. And the violation.
Yeah.
That is
But I love how it's opening up conversation about these unconsented to medical procedures that are done on women every day, all the time.
That's so sick.
So I want to talk about a couple of those procedures that are done. You have the husband stitch, right?
Yeah.
Which is that extra couple stitches sometimes that an OB will put in a woman. Most times they don't ask for it. Sometimes the husband even asks for it. Sometimes the OB just does it and is like, oh, I put an extra one in there. Okay. The side effects of that, the chronic pain, painful sexual intercourse, like long term, which leads to an avoidance of sex and obviously a deterioration of intimacy within your relationships. Obviously scar tissue and scarring because you will possibly tear repeatedly during intercourse.
Oh.
Those extra stitches are exterior. They are not inside. This is not a rejuvenation. It can cause nerve damage, increased risk of infection.
Oh, yeah.
Decreased sexual pleasure, of course, because it's unnatural tightness. It can lead to reduced satisfaction. It can make it difficult to even use tampons. And then that's not even talking about the psychological effects of like emotional distress and trauma and loss of bodily autonomy.
Yeah, autonomy. The autonomy that's lost.
And you trust, especially in those situations, especially when you're giving birth, you are so exposed and there's so many people in the room and you're just trusting. Now imagine if you have any trauma in that area and you're just on display and being, trusting.
Yeah.
There was a study in 2003 in England that found that 53% of medical students performed intimate examinations on patients that were under general anesthesia.
What percent was that?
53% of medical students.
Whoa, what?
And in 2005, a U.S. study revealed that nearly 75% of medical students believed patients did not consent to their training in pelvic exams.
Why are they doing them?
Because they're able to. It's technically legal, although the federal government says that you shouldn't be doing that. But at teaching hospitals, it's buried in the consent that for educational purposes, they can do crazy stuff.
What entitlement from the medical students and the culture that those medical students are influenced by in that hospital.
Those medical students, they're like the pressure of med school and being forced to do things that even go against your own personal ethics is huge.
Oh, I didn't even think about that or realize that.
Yeah. So it's, even though you would hope that medical students would say no, like there's dire consequences to saying no. So you're this in-between person. Yeah.
Yeah, because the medical school basically holds your future in their hands.
Yeah, and they say you have to know how to do this, and this is how we get enough people and enough exams to do it so that you're competent. A 2019 study from the World Health Organization, they did a study across multiple countries, and they found that 75% of episiotomies were performed without consent.
What's an episiotomy?
An episiotomy is where the doctor, when you're in labor, the doctor will cut you. Instead of letting you tear, they will cut you from like vaginal openings, sometimes all the way down to the anus.
Whoa, what the heck? Whoa.
Yeah.
What percent?
75%. My mom had an episiotomy with every one of her children. There's a doctor I worked with in the OB, routine. She did it with every single patient.
And regardless if they ever...
Regardless if they needed it or not. And in fact, it's pretty rare that you actually need one. And it's usually better to tear, even though that sounds worse. A tear might only go through a layer of tissue. But a cut with a scalpel is going to go through multiple layers.
Yeah.
There are some situations where it is an emergency. You got shoulder dystocia. You've got this baby is legitimately stuck.
Yeah.
Like there are some circumstances where that is necessary.
But not a majority.
And definitely not justified through routine episiotomies.
Can women sue for this stuff?
No, women really can't sue for this stuff because again, when you're signing the consent, you're saying that you're allowing them to do whatever is necessary.
Whatever they deem necessary.
Yes, whatever they deem necessary.
Yeah. It really should say whatever is necessary, not what they deem necessary.
That same study reported that 59% of vaginal examinations during childbirth, so when they come in and they check you to see like how dilated you are, occurred without consent. Because they'll just come in the room and they'll just say, we're going to check you. And they're not asking. They're not nothing. They're just coming in and doing.
Are these all hospital births? Because I know that you have home births, but you also aren't there like birthing centers?
Yeah. So if you do a home birth, if you're with a midwife, if you do a birth center, your chances of having an unconsented to episiotomy or an unconsented to vaginal examination is significantly lower than if you birth in a hospital.
Are there midwives that work in hospitals?
Yes.
So you can have a hospital birth with a midwife and your chances for this stuff happening is lower?
Yes.
Wow.
I'm talking about certified nurse midwives, CNMs is what I'm talking about.
Sounds like so much better.
Yeah, I mean, it can be, especially for non-complicated pregnancies.
Yeah.
In a lot of other countries, not in the U.S., but a lot of other countries, even in the westernized world, utilize midwives more than they utilize, like the OBs are reserved for complicated cases. And they are needed, and they are specialized, and they are important. So I'm not saying that. But not everybody needs that level of care in a pregnancy. And a midwife can do everything an OB can do minus a C-section. And they work under OBs. So you're not getting a lesser quality of care. Also, there's something called like cervical sweeps that are done where they stick their fingers up there and they sweep around the cervix. And
well, that sounds painful.
It's also called sweeping of the membranes. Sweeping your membranes.
Oh, I've heard of that before.
12.5% they found in this study, again, World Health Organization study, 12.5%. This is anecdotal, but in my own circle, like that happens and women don't even realize it. They go in they get checked at their 38-week appointment and the doctor does it and it can be painful.
Yeah, it sounds like it would be painful.
And then they say, oh yeah, I did a little sweep while I was up there. It technically can increase your risk for infection.
This sounds like just archaic stuff.
Now, it can be beneficial, especially if you're more overdue and you need to move things along.
Yeah.
But at 38 weeks, you're not overdue and you don't really need to move things along.
Were you offered that with one of our kids who was overdue? Maybe
yes,
it was our last
I
kid?
did. Out of the 4, I did have my membranes stripped twice and I gave consent.
I feel like when you're not doing these things with consent, it is archaic. It reminds me of like the 1950s.
Yeah, right? Like women getting locked up in asylums, women getting lobotomies because their husbands say so and they're not consenting to that.
Yeah, the husband stitch.
And how is that not male-centric? That does not increase pleasure for the female.
No, it's like you wink at the husband, say, put a little extra one in there for you, buddy.
Yeah, your wiener's got to be pretty small if you ask for it too and you're a guy. Do you know what diastasis recti is?
I sure don't.
It is when your abdominal muscles separate in the middle and come apart.
That happened to you.
Yeah, so I do have a small one. I do. But they can get really big to where usually they measure them by fingers, like, oh, 1 finger, 2 finger, 3 finger, 4 finger. Okay. Like, they can be big. They can be 4 fingers across. They can be completely gaping open, like inside, right? And it can cause, a lot of times this is caused by pregnancy and childbirth. It can be caused by obesity, weight fluctuation, weightlifting, genetics, age can have something to do with it. But by and large, it is a lot of times happens as a result of pregnancy, multiple pregnancies, a lot of times, and childbirth. But it doesn't have to be multiple. And Lord forbid you got multiples that you're having, like as far as twins or something like that, you're really in trouble. As far as your risk factor for that, it goes up. But it can cause back pain. It can cause hernias, like internally hernias, because it's your abdominal muscles are open.
Yeah, right.
Poor posture. It can lead to pelvic organ prolapse, abdominal pain, bloating, constipation, and then it can cause this visible like belly pooch, right? Because your muscles aren't together. And no amount of working out is going to fix this. There are things you can do with pelvic floor PT. There's things you can do with physical therapy that can make it a little better. But especially if you have a large one, the chances of that coming together is pretty slim.
Yeah.
If it's severe enough, you have to have it stitched back together. At the 21-week mark, about 33% of women will have some degree of this. And then that increases to 60% of women at the 6-week mark postpartum-wise. About 45% of those women will still have it at 6 months, and about 32% will still have it at 12 months. In general, in the female population, it's about 52% of women by the point that they're at menopause have some form of this, some degree of this. It's pervasive, and it can cause big problems, right? So I had a follower write in and asked, can you talk about this on your podcast and how there is no insurance coverage to have it fixed surgically?
What?
Because it falls into the tummy tuck category and it's assumed to be cosmetic purposes only.
Who makes up that rule? Insurance companies?
Well, Aetna says, hey, guess what? Diastasis recti is considered not medically necessary because it does not represent a true hernia and is of no clinical significance. That's what Aetna says. Cigna says this surgical procedure to correct this condition is cosmetic in nature and not medically necessary for any indication. Even when the diastasis recti causes functional issues like back pain, insurance companies typically do not cover the repair.
Yeah, because they don't want to cover stuff.
And the coding, exactly. The coding for it, the CPT coding for it, is considered like it. There is no other code for that kind of repair that is not a cosmetic surgery code.
Unbelievable. 50-something% of women by menopause, and it's not covered typically by insurance.
Yeah, I did not find an insurance carrier that said that it covered that surgery. By and large, just that procedure is not covered due to it being considered cosmetic.
Gosh. So then you just have to live with it.
Can I see your phone? I want to show you a picture.
Yeah, cosmetic. Seems pretty functional to me. By the way, I'm sorry. You can edit that out. I'm sorry I just outed you for having experienced that. I didn't.
No, you're not outing me. It's fine.
Because, that's your business.
Okay, so you can see how her abdominal muscles are separated.
Holy cow, that's considered a wide one?
I mean, this actually is probably pretty moderate. It's probably not one of the more severe ones.
It's like 1.5 inches.
They can also look like this.
Help. Oh, no. No.
Like this lady's got 4 fingers across.
Oh, my.
Yeah, it's cosmetic. We just don't want to have a mommy pooch, It's got nothing to do with the fact I can't support my torso.
Yeah, that your abs have separated.
It'd be amazing to dive into the true hell women go through and the quality of life issues with this and the stigma around getting it fixed. Not to mention the cost of getting it fixed. I'm having my surgery this week and my belly button hernia and abdominal separation is so bad that my surgeon said he has had only one other case like it in the last 20 years. Half of my consultation was my husband not understanding why an issue with someone's anatomy like this isn't covered by insurance. It's by and large a female issue, Jay. It's by and large a female issue. I'm not saying men can't get it. Men can absolutely get this. But women, being the bearer of children, often bear the brunt of this condition. And it is not a condition that is covered.
That's stupid. Like, I wish I had better words for it, but like with things like this that just don't make sense, the only word I have is stupid, you know?
Well, that brings us to the end of another episode.
We need to start ending episodes with something upbeat. If not for the listeners, just for me.
Like to distract us from the realities of the world we live in.
Like the lioness, that pirate woman. That's, ending something like that.
With like a BA woman story.
Yep.
Hey, anybody has a BA woman story, you should email us.
Yeah.
pinkpillrx@gmail.com. If you have a story in general that you want to share, email us at pinkpillrx@gmail.com. Because your stories matter, and we like to share them because it helps others feel seen and known and heard.
I love hearing all the experiences too.
Yeah.
It's very eye-opening, and I have a lot of compassion and whatever, empathy, and just, I mean, Katie can tell you how it is. I feel empathy with my whole body. Yes. Somatic empathy.
Somatic empathy is what we call it.
Yeah.
If you enjoyed this episode, please take a moment to rate and review us on your favorite podcast platform. Your support helps more women and men find our community and join the conversation.
Yes, and it's an important conversation to have.
And don't forget to follow us on YouTube and Instagram to stay connected.
Yes.
Especially with this uncertainty surrounding TikTok.
Yes.
And if you want to go the extra mile in supporting our mission, consider joining our Patreon for just that $1 a month. It is linked in the show notes. And every contribution, no matter how small, helps us continue bringing you this content.
Thank you. Thank you so much for just being a listener and supporting us through your presence.
Yep. Until next time, keep sharing, keep listening, keep empowering each other.
I hope for those of you listening, something was intriguing or sparked a curiosity, or you felt affirmed or challenged. Stay educated. Take the pink pill. If you enjoyed this podcast, please give us a follow and maybe a nice review.